So as the world scrambles to find a vaccine for COVID-19, there are many institutions around the world that are collaborating with governments to try and find a solution. The Tony Blair Global Institute for Global Change, led by former British Prime Minister Tony Blair, is also involved in efforts to address health challenges. Kate Dooley from the Tony Blair Global Institute for Global Change joins me now live from the UK. Kate, a very good evening to you. Thanks indeed for your time.
Thank you.
Kate, I understand that the Institute is focused on how it can advise governments on how to keep their people safe, but not just in respect of COVID-19, but what the former British Prime Minister described as collateral damage that's done by the virus. Tell us about the three areas the Institute is focused on.
Thank you. Well, at the moment we're working, and we have people embedded working as advisors to government and sort of partners to governments in around 14 countries across the continent. And we're particularly focused, obviously, at the moment on the sort of crisis need, the immediate policy decisions, of which there are many and overlapping decisions that need to be made by leaders and political leaders. So we're focused on some of those immediate questions around how and when to ease lockdowns, what are measures to maintain, how to maintain your COVID response, your testing capacity, isolation capacity, these types of things. We've also been looking at sort of the broader social and economic impacts, so some of the gaps that are starting to emerge around health service provision, while in some cases across the continent very limited resources have been diverted to trying to deal with COVID. And of course, with lockdowns now, sort of a lot of governments starting to ease those, but they have had a very severe impact in a lot of places, particularly where food security is an ongoing challenge, even without coronavirus.
Yeah, and that's one of the issues that I wanted to touch on. I mean, the issue of poor health systems on the continent to tackle this global pandemic, and the shortage of medical equipment remains a challenge. What kind of support is the Institute providing to ensure that this production capacity is increased?
There's a few different things that we've been doing. I mean, in some cases, there is embedded existing manufacturing capacity that can be repurposed. So, Ethiopia is a great example, obviously, but there are many other governments across the continent that are manufacturing textiles and garments, for example, who have been relatively easily been able to convert that to produce protective equipment for health workers and the broader community. There's also many countries where they're looking at how they can be manufacturers themselves of treatments once those are established through the clinical trials that are currently underway. And also, as your own president, I think, has mentioned recently, looking at how Africa can produce the vaccine once it's sort of developed itself on the continent. Because one of the big challenges with a pandemic, as opposed to some of the other public health challenges and outbreaks we see, is the entire world is challenged with the same thing at the same time. They need the same supplies, and there's enormous competition for those supplies. And we have a lot of shortages, particularly of diagnostic equipment, emerging now right across the continent.
Yeah. So, I mean, the Institute over the past few days has also said that priority must be urgently given to investigate the COVID-19 situation in Africa, to find out what factors lie behind the low mortality rates. Is it not satisfactory, for example, that this could be perhaps that there may have been swift action and many governments took to lockdown at the beginning of the spread of the coronavirus itself? Hence, we're seeing on the African continent, many have argued that have relatively done well in terms of dealing with the spread of coronavirus here in Africa.
Yeah, that's absolutely right. I mean, governments acted swiftly. I mean, a lot of countries had their borders closed and economies starting to shut down before they even had the first case confirmed in many countries in Africa. So there's no doubt governments acted much more quickly. They have much more experience with infectious diseases. So you already have community surveillance, you have community health workers, you have systems that know how to respond to these things. You have some of the diagnostic capacity in place. So I think that sort of is a logical factor here. And the point that Mr. Blair was making last week and the Institute has been saying around the need to sort of really interrogate all of these factors is just simply because we need that evidence, because we need to be sure precisely what is going on. We do see a kind of slower progression of the outbreak across the continent. We do see kind of what looks to be lower mortality rates, But we also know that there's not a lot of testing happening in some countries. South Africa is an outlier. You guys are way ahead of everybody else on the continent. But a lot of places, there isn't a lot of testing going on. So it's very likely they're just missing cases, potentially missing deaths. Cause of death isn't always recorded in majority of cases, really, in other parts of sub-Saharan Africa.
So what you were saying also is that African nations should use antibody tests to find out whether the slower spread and mortality rate on the continent is due to what has been described as patchy data, or if there's more resilience in terms of the population. What impressions are there then that perhaps a true picture of the impact of the virus on the continent is not being painted?
So I think we see, for example, there in South Africa, you've got a very large number. I think it's over 10,000 tests, the regular PCR test, the immediate test, being conducted per million people. But Ghana, Rwanda are two others that are doing a lot of testing as well. But in many, many countries, the kind of average across sub-Saharan Africa now is less than 1,200 tests per million people, whereas you've got now in the likes of Europe, countries that are hitting 50,000 tests per million. And so you have very large numbers of cases. We also know that a very large proportion of coronavirus cases have only mild or no symptoms whatsoever. So there are a lot of people who have this virus but simply don't know and are spreading it around to other people. And you only can sort of confirm all of that with testing. Now, with limited diagnostic supplies for the sort of on-the-spot, immediate live testing, the PCR testing, what we suggested is that some governments who are really struggling to get their hands on the quantities of those supplies and all of the auxiliary equipment that they need around it, such as reagents, that antibody testing may be another thing that's worth considering, especially for health workers. These are the group that are at the highest risk of exposure. Perhaps there are other categories of essential workers like public transport workers, things like that, most high risk of exposure. If you complement your current testing strategies with antibody testing, you can start to build up a sort of broader picture and understanding of what has happened with transmission of the virus. And one of the reasons I think that is actually going to be very important is that if it is the case that sort of most of Africa is sort of actually a few weeks, maybe a couple of months behind, say, Europe and Asia, then those economies will start to open up, and they're starting now to struggle with how do they reopen international travel. And ensuring that governments actually have information on what's happened with coronavirus in their country might actually be incredibly important to their ability to sort of re-engage with the global economy in time.
And also, I know that Mr. Blair's also said that he was rather unimpressed with the global coordination picture. And he has said that, there's been a shocking absence of it. Do you think that governments then would need, during this time and even post this crisis, re-look at the global architecture of governance?
Yes, absolutely. I mean, I think that there's no doubt there's been huge challenges with global cooperation and coordination. There's been some delays, if you like, in looking at the coordination efforts that are required in Africa as well and for Africa. We have now got the Africa CDC, WHO and others standing up pooled procurement, for example, for those essential medical supplies that we were talking about earlier. Because, of course, the continent is over 50 countries. Some of them are tiny. Some of them are trying to place orders for, 5,000 test kits, while you've got some European countries asking for 5 million. So, those types of approaches are starting to emerge now and are going to be critically important. But absolutely, there are lessons to draw here. And one of the really important ones for Africa, I think, has been this sort of incredibly valuable role that the Africa CDC is playing, which is a relatively new institution. It's only about 3 years in. That was set up primarily since Ebola. I think African institutions are proving, unsurprisingly, best equipped really to respond. And I think investing in those sorts of institutions and the mechanisms that the African Union is setting up are going to be a key part of the coordination needed in the short term, immediately for coronavirus, for other, health outbreaks, and certainly going forward in the future as well.